Welcome back to part 4 of the Jacksonville Urban League's Health and Wellness in the Workplace, the Entrepreneur Center's Health and Wellness in the Workplace. Now we're going to talk about staying protected from COVID-19. What are the business benefits of staying healthy? Keep the workforce healthy by preventing employees from getting COVID-19. Let's face it, if an employee gets COVID-19, that will interrupt your business. Help protect clients, customers, and visitors from COVID-19 illness, reduce absences due to COVID-19 illness, improve productivity, improve morale, build trust, and be responsive of your employees' needs and cultural norms. Protect your business and keep each other safe. And that's what it's all about. That's why the big push about getting vaccinated, because it not only protects you, it also protects others around you. Get Vax, offer incentives for employees to get vaccinated. Sure, some businesses have even offered a bonus to their employees because, as mentioned, as we all know, if an employee gets test positive, then your business may have to close, and that then affects the bottom line. Encourage employees to get tested regularly and stay home if sick. You don't want someone to come to work knowingly sick and infect the rest of the business. Wear a mask at all times when around customers or clients. When a client who's concerned about getting the virus walks into a business and see that you care about them because you have put up barriers like a plexiglass stand, for instance, if you are a storefront that has a cash register, for instance, and or if you simply have on a mask, that shows those customers that you care about them. You're not necessarily wearing the mask for your protection, but you are wearing it for your protection, but you're showing that you care about them by having a mask on. Perform routine cleaning and disinfection in the office. You may have to add in your budget a cleaning service that you normally did not if you are unaware of what to do. However, there are resources on the Centers for Disease Control for businesses on how to clean your businesses, disinfect it in the office or in the workspace to minimize exposure and risk. Offer paid sick leave if employees get COVID. Now, maybe that's not something that you've done before. However, but if that employee gets COVID and it's spread throughout the business, you'll lose business. So the little bit of money that you invest by simply offering that employee paid sick, that will help your bottom line. Staying protected against new variants. Sure, we've known about the Delta variant, and then there's the Omicron variant. The highly transmissible and deadly Delta variant has been detected in 99% of cases in the US. And at this recording, the Omicron variant is now at present in about 15 states in the country. Now, it's not a matter of if it's coming to all states, it's a matter of when it's coming. Even if you do contract COVID while vaccinated, the vaccine is 96% effective at preventing severe disease or death. Now, there's a lot of speculation. Why do I need to get the vaccine? Because it's not going to prevent me from getting the virus. No, but look at that statistics. Getting vaccinated you have a 96% chance of preventing severe disease or death. All US approved vaccines are more than 85% effective at protecting against new variants. The more people that are vaccinated, the less new variants. And of course, we want to protect not only ourselves, but we want to protect our children, our family, friends, co-workers, and ourselves from getting sick by getting vaccinated. That all of us want to resume our normalcy. Remember what normalcy looked like eons ago? Eons ago was 2018, because 2019 began a new year for all of us, 2020. If you've already had a full dose, check when you're due for a booster. Sure, we may have to get a booster, or we should get a booster, because what you're doing is building up your immune system, those antibodies, just in case you are exposed to COVID-19. Let's take a look at two of the three of the vaccines that are available to us in the United States. If you receive Pfizer, BioNTech, or Moderna, you should get a booster. Who should? Everyone 18 or older. When to get a booster? At least 6 months after completing your primary COVID-19 vaccine series. For instance, I received my second vaccine in March, so I got my booster in October. Which booster should you get? Any of the COVID-19 vaccines authorized in the United States. So what does that mean? If you got a Moderna vaccine, you can get a Pfizer booster. If you got a Johnson & Johnson vaccine, you can get the Moderna or Pfizer booster. If you receive the Johnson & Johnson vaccine, who should get a booster? Everyone 18 years or older. When to get the booster? At least 2 months after completing your primary. Now, as you see, that's different than if you got Moderna or Pfizer. With those, it's 6 months. But with the Johnson & Johnson, at least 2 months after completing your Johnson & Johnson booster. Which booster should you get? Again, any of the COVID-19 vaccines authorized in the United States. And as you can see at the bottom of the slide, or if you can't see it and it's only there for me, you can always go on cdc.gov coronavirus/2019, or simply put vaccines.gov, and you will find all sorts of information about the vaccines, the virus, and the boosters. Know your insurance options. Florida Medicaid. Residents of the state of Florida whose financial situation is categorized as low income are eligible for health coverage. Enroll in a health plan. Again, just, Google, type in Florida Medicaid, Florida Medicare, Obamacare, but it's really called the Affordable Care Act. Why are we talking about insurance options? Because all of us need to be insured just in case we are diagnosed with some disease. Now, I often tell people, sure, and younger people, younger adults really think this way. They don't need insurance, they don't need a doctor because they are younger. Well, we all do, because there are some things that we can do something about, like exercising, eating healthy, maintaining a positive stress level. However, there are some things that we cannot do about that increase our risk of certain diseases. For instance, as we age, that increases our risk of certain diseases. Our race or gender increases our risk of certain diseases. So if you have a family history of diseases, no matter what you do, unfortunately, you may be diagnosed with diabetes, for instance. Yeah, we talked about ways that you can reduce the risk, but it is important that you know what your risks are. And I always encourage people to know your family history, know your family health history. But to prepare for that, we've all been told how important it is to get insurance. Now, as a business, you may not be able to afford to insure your employees, but what you can do in your onboarding process is share with them, because you've done your homework. You have information, a handout on Florida Medicaid, Florida Medicare, and the Affordable Care Act as options for your employees. Of course, we know Florida Medicare is the country's health insurance program for people 65 and older or younger people who receive Social Security disability benefits. Again, just Google Medicare, or you can simply call the Florida Department of Health, the Agency for Healthcare Administration, which one of those organizations. Go on myflorida.gov and check, and you'll be able to find, or again, as nothing else, Google Florida Medicaid, Florida Medicare. And as far as the national option for us, the Affordable Care Act, Obamacare, to qualify for cost-assisted coverage that meets the Affordable Care Act standards. Again, there is an open enrollment period, and depending upon when you're watching this video, it is in November, between November and January. So again, there are options for us. So your business may not be able to offer plans for your employees, but what you can do as a good business owner is to do your homework before you bring folks on board, so you can share this important information with them on being insured. How well do you know health in the workplace? Let's play. How well do we all know health in the workplace? Is something that we don't think about. When we open up a business, we just think about how much money we can make, how we can earn income for ourselves and our family. But it is important that we maintain a healthy workplace. Stress in the workplace makes for healthy, productive workers. Is that true or false? False. Stress reduces immune system function and can lead to poor health of employees and unmotivated workers. That's why we talked about in this series the importance of mental health, knowing when it's time to go and seek counseling. We also talked about the importance of eating to build your immune system. We talked about staying fit, getting up, walking. So it is important that we learn how to reduce the stress in our lives. COVID symptoms and anxiety symptoms can have overlapping symptoms. Did we talk about that in a previous slide? Do you remember? That's true. Chills, shaking, sweating, chest pain, and shortness of breath are all possible symptoms of COVID-19 and anxiety attack. And you can learn more at the National Institute of Health. Employees need access to a gym to be able to benefit from a workplace health and wellness program. Is that true or false? False. A gym is not a necessity to living an active lifestyle. Remember, we talked about taking walks during lunch break or meetings can be a very effective way to stay fit in movement throughout the workday. Again, also available at the Centers for Disease Control. Eating a healthy diet can help decrease chances of suffering from life-threatening side effects of COVID-19. Is that true or false? True. Eating a variety of whole foods can boost one's immune system and help them fight COVID-19 faster and with less severe symptoms. And we talked about why it's important of having that balance in terms of eating healthy and building your immune system. The COVID-19 vaccine harms fertility. Heard a lot about that. Is that true or false? COVID-19 vaccine only targets COVID proteins, not pregnancy proteins. Again, more information is available at the Centers for Disease Control. If I had COVID-19, I don't need a vaccine. Is that true or false? False. The risk of getting COVID, again, is over 2 times higher if you had COVID and if you're not vaccinated. The vaccine gives you COVID-19. Have heard a lot about that. Is that true or false? False. None of the authorized COVID-19 vaccines in the United States contain the live COVID virus. Now that might be something different because we know with some vaccines like the flu, there may be some live virus in it. But when it comes to the COVID-19 vaccine, there is no live COVID virus in it. Again, Centers for Disease Control, learn more. The vaccine is not safe and was developed too quickly. Very false. The vaccines are almost 100% useful in preventing COVID-19. Now, notice I said almost 100%. We talked about there is no 100% cure for COVID-19. However, what it can, the vaccines that are available for us in the United States can greatly reduce our risk of getting very sick and of course dying. And millions of people in the United States have received the COVID-19 vaccines and they have been proven to be very safe. Where to get vaccinated? There are lots of places listed on this slide and even more options pop up throughout the community. The best thing to do is go on vaccine.gov, call the Florida Department of Health, 904-253-1000, and you will learn where to go to get vaccinated. And you can also go on vaccines.gov. That's vaccine.gov. If you, all of us are online shopping for clothes, shopping for concert tickets, shopping for all sorts of things. Shop for where to go to get vaccinated. As you can see, some large retail pharmacies, including CVS and Walgreens, as well as even Walmart, offers vaccines. So don't let not knowing where to go be your reason. Also, most of these places, or many of these places, offer testing just in case you or your employees need to get tested. Questions about COVID-19, questions about anything that we learned today. Throughout the modules, we talked about where to access information, reliable information. Of course, that includes the Centers for Disease Control, the National Institute of Health, but locally, call your doctor, call the Florida Department of Health, get your questions answered. The Northeast Florida Medical Society, for instance, a partner of the Jacksonville Urban League, is available to assist you to answer questions. They've done many workshops. I am an entrepreneur. I've gone through the entrepreneur program with the Jacksonville Urban League. My experience is I worked for the Florida Department of Health, retired, and now own my own business. So just like you, I am also very concerned with staying healthy myself, learning how to keep those around me healthy, and making sure that my business is thriving, just as we all do when we made the decision to become business owners. I hope you enjoyed this series. Always remember, stay healthy, be productive. That's all, folks.